Welcome to Speaking with the Senator. I'm Senator Kevin Avard, your host. I represent Nashua and District 12 here in New Hampshire. And I'm the Chair of Energy and Vice Chair of Health and Human Services in the New Hampshire Senate. And it's been probably one of the toughest years that we've had this year. We've had so many bills come before us, and everything from energy and healthcare issues such as freestanding emergency rooms, vaccines, you name it, it's come before us. And so we wanted to invite some of our local folks from one of our local hospitals to come and talk about some of the issues that might be affecting Nashua. And with that, I'd like to introduce my guest, Rebecca Cooper Piela. And you are
I am the Chief Quality Officer for Southern New Hampshire Health.
Southern New Hampshire Health. So a little background on Southern New Hampshire Health. When I was a kid, I used to live on Harbor Ave, and I had a tennis racket and a tennis ball, and I used to go and play tennis against the walls until I used to get kicked out. They didn't really appreciate that. Probably the patients didn't appreciate that either. But it's had a long history of being there and serving New Hampshire and serving Nashua. A friend of mine, I think, just cited it recently. So welcome, and really thank you for coming onto the show.
Thank you so much for having me.
Yeah, and so I recently, last year, I think it was last year around this time, I required your services. I had a heart attack, and I was 7 minutes away. We called it in, and there was a whole team of people there just waiting for me. They knew my name, everything, by the time I got there, which was quite an eye-opening experience. But being in the ambulance, I was kind of being jovial. I didn't know what's going on. I just didn't feel good, a little throat problem. And they put these little stickers on me, and I said, "So how am I doing, folks?" "Mr. Everett, you're having a heart attack." Boom, everything's in slow motion. They put the pills in, they put the things on, and they call ahead. "Where are you going?" I said, "I'm going to Southern, 7 minutes away." Get to the door, there's a team waiting for me right there, ready. Put me on whatever I had to go on to and saved my life. I talked to one of the nurses, Rita, I think it was her name, and she said, "We usually have about 90 minutes. You had about 20 minutes left." And Southern was there, and it was, boom, we had a great surgeon. And so, number one, thank you. And this is a service that you folks provide, and you are ready. So can you talk a little bit about your emergency services there?
Absolutely. So first and foremost, thank you so much for sharing your story. I'm so glad that we were there to serve you, and I'm so glad that you're doing so well now. That's really our mission and why we're there.
Yeah.
And that's wonderful. So we are available for emergency services for multiple things. So for things like heart attack, which you experienced, we also have services that work very similar to that for stroke care. We have a certification in excellence in stroke care that we make sure we're at tip-top shape and ready for people to go on arrival again, communicating with our ambulance services. We're also recognized for a trauma certification. So if people have significant accidents or injuries, and we have neurosurgical staff there to assist if that's needed for any complicated injuries. So we want to make sure we're there to serve our community in totality. When you arrive, that we're at the ready for you.
Yeah.
And there for any follow-up care after that you might need as well.
Right, and it was like clockwork. You had the team; they knew what to do every second of the way, and I really do commend you for that. So, what's your reach? How many people do you serve on a routine basis?
So we have a population of primary care patients that we care for that are about 70,000 to 80,000 patients. In our community that we're responsible for the totality of their care, coordinating all their care, all their services, all their needs between the medical center, that is the hospital that we know for emergency, but we also have outpatient practices and providers in those practices that are there to serve needs, whether it be for primary care, preventive health care, specialists, for any follow-ups that you need after you might be in the hospital. So we really try to make sure we're serving that community holistically, coordinating all that care for our community.
So I think you told me you had a background in nursing.
So I originally started as a nurse, and then I went on to become a nurse practitioner. When I graduated from nurse practitioner school, I came to Nashua, and I've been here at Southern Hampshire Health for about 30 years now.
Wow. So having that background, how does that affect your position? How did it...
So I originally came as a nurse practitioner, and I started as a primary care provider. So I had patients come see me for their primary care, manage their needs, refer them to our emergency room or other services or specialists that they needed.
Right.
On my journey, I began to do some work in our quality programs, and now I oversee quality and safety, our accreditations, making sure that we're in tip-top shape for everything and we're giving the highest quality of care. Even though I don't have a panel exclusively anymore, I still see patients. It's really important for me to continue to provide care. So I still work in our primary care practices weekly, make sure that I'm taking care of our patients, that I'm hearing their voices. That's super important to me to understand what their needs are and to make sure we're doing a really good job caring for our community.
Well, you answered that very well because my wife, she works at another hospital in Massachusetts. She travels to Massachusetts, and she's in mammography. She started off in X-ray and eventually moved over into mammography. She's been there doing that for about 35 years. And she's seen managers in the past. And one of the things that I get the shop talk, right? I don't get any specifics, but I get the shop talk so she can unload. And today she had to do either 2 biopsies and a needle loke and all that kind of stuff. And, she follows the patients and makes sure that they're very comfortable. But, when you have a manager on the floor that sees, what you're going through, it makes it a lot easier for the staff to perform at a certain rate. But if you have somebody that has a degree that just gets into that position, you don't have the empathy that is necessary. So it's critical, and I think that's wonderful that you have that background and that you're staying in touch, being in touch really, because then you keep an eye on the patient's needs, right?
Absolutely.
So what are some of the needs that you think Nashua might have right now? Do you see any things that the legislature should be looking at, or do you have plenty of nurses, plenty of doctors? Are we always?
So I think we're always in need of more. Right?
Yeah.
I think that thinking about education, about our workforce, building a workforce in totality for a health system. So yes, we need nurses. Yes, we need doctors. We need folks like your wife. Critical importance. So there are a lot of roles that people don't think about necessarily in the healthcare system, right? We even need folks that do engineering and building support. We've got to keep the lights on and everything running.
Right.
So thinking about workforce development in general, we see a lot of housing needs for our community and our patients. So that is something that I think is important for us to have in our mind as well as we move forward in time.
Yeah.
And we continue to see needs around behavioral health, so supporting our community and our patients there. We have the pleasure of doing a program called The Doorway, where we offer treatment and care for those that need any assistance with substance misuse. And so I think those things are very important for the health of our overall community. Yeah,
substance abuse is it is quite the issue that keeps rearing its ugly head. And we had to, we talked about needle exchanges and all that kind of stuff, and finding needles in the park. And it's easy to walk by and kind of like, hey, get your act together. But if you're hooked on something, it's not that easy to get off. And a little compassion goes a long way, because if you have a problem with addiction, it's not as simple as saying no.
No, it's a complicated illness,
Right.
And we want to make sure we have those resources to support our community and our patients.
In that field, though, there's also you have to have safety for your staff as well.
Absolutely.
Yeah.
Safety for our team and our staff is very important as well. So
Right.
support around those areas is also very much appreciated for our team members.
Yeah. So recently, I had the privilege of doing a ribbon cutting on Amherst Street, and it's exciting to see more businesses come into Nashua, and it had to do with it's called a freestanding emergency room. So I applaud the businesses coming. How is that going to affect the hospitals? I mean, we have St. Joe's, we have Southern, and I think on Prospect Street we have, there's another one down there, but that's just a medical.
So we do have an ambulatory surgery center down there, and we have the medical center, so all part of Southern New Hampshire
That
Health
is
there
part of
on,
Southern.
on
Okay,
Prospect
yeah.
Street. Yep, yep. So I think it's important that we make sure that our patients have choice.
Mm-hmm.
I support our patient experience programs, and we've coined those programs Walk With Me. And the reason that we coined that Walk With Me is we want to support our patients across their healthcare journey.
Right.
And that journey looks different for different people. So it's super important for folks to understand what that journey is going to look like and what that means for them in their healthcare. If someone presents to a freestanding emergency department, let's say in the experience that you had, there might be a delay in getting to that cath lab and making sure we get the care that we need. And we want folks to understand what care is rendered in what setting so that they can make the best healthcare choices for themselves.
Right. Yeah, and there is some legislation that we did put forward to make sure that those patients' choices are protected. Hopefully, it makes it to the finish line. We're working on that. But if you have a primary care in one town versus in another town, you want to stay close if you have that ability to make that choice.
Absolutely. So having served as a primary care provider, it's been wonderful for me to be able to refer directly to my hospital colleagues. I'm able to see what's going on with my patient in real time. I'm in the same electronic medical record, and I understand intuitively what they need for follow-up. It's listed in the medical record. I'm not repeating their testing, spending extra money on their health care, doing additional labs because maybe I couldn't see them and I don't know if I need to do them again or not.
Interesting, yeah.
In addition, we have a program for care coordination that follows our patients that have high needs or are complex to make sure we're assisting them in plugging back into healthcare wherever they might need to be in the system. Our patients also have the opportunity to access their own records. So we have what's called a MyChart.
That's been an issue lately. Yeah, people have been talking about that. Legislation's come up. People want to have more access, and that's a real concern for some folks. Who knew?
Yeah, but it empowers folks. So if folks want to be able to look at that, they're a part of the team with us and taking care of them, right? They have thoughts and opinions and choices, and it's our job to make sure that we engage them in those choices and we have that open dialogue and we make sure that they're going in the direction that makes sense for them for their healthcare choices. And some of them feel very engaged. They want to read their notes, track along their test results, and they're able to do that and look at that full journey from one point to another.
Recently, I went to, I think it was the National Community College, and they had a nursing school there. Do you draw from that at all?
So we do have students that come from there. I had the pleasure in the past year, we sponsor an MA apprenticeship program in conjunction with them, and I had the pleasure of speaking at that MA apprenticeship graduation. Incredibly moving to hear some of the experience of some of our students that went through that program and what it meant to be part of a healthcare system and what they felt engaging and caring for patients and how meaningful that work was to them.
Yeah.
And a lot of them thinking about pursuing additional journey in healthcare as they move forward in time.
Yeah, I was impressed. I've seen the college, I go by it all the time, and the president invited me, and there's an aeronautical, there's the mechanical, there's auto body, and then he brought me into the nursing section, and it looked like a real nursing, and it's a tough course apparently, and it's like a treasure in plain sight in Nashua. It's a beautiful facility.
Absolutely.
Yeah, they really have done a great job, and I think if somebody wants to get into a career, that's one of the places to go. Of course, you got the two local hospitals, and obviously you're partial to yours. Yeah, but I thought that was rather interesting. So, are there things that your folks are working on for the future that to expand in Southern?
So right now we're working on a cardiovascular lab to ensure that we can serve our patients with heart disease and make sure that if ever there's an emergency, we're always at the ready and available for anybody that comes to see us.
Yeah.
So that's one huge project we're working on now. In the areas that I look at and cover, we do a lot of work around accreditations. And what that means is it's sort of an external body that comes and assesses you, like a little checklist and a report card, if you will, to make sure we're doing the absolute best in whatever area. We're really excited that we were just awarded a level 1 participant as an age-friendly health system. So we know in New Hampshire that our state is aging. It's important that we have a system that's facile and ready to navigate for our patients in our community that's aging, and that we respect and understand those needs. So we're excited about that work.
Very interesting. Yeah, I happen to be the chair of the Alzheimer's Association subcommittee, and it's amazing to think that Nashua's, not Nashua, but New Hampshire is the second oldest in per capita in the nation. I thought it would have been Florida.
I know. It is surprising,
but
isn't
it? Which means there are needs that specifically for us aging people that you're going to have to be able to deal with. So about Alzheimer's, do you see a lot of patients with that as well?
So as patients age, we do see concerns with dementia, and we want to make sure that we give them the appropriate support and care in those areas. We do have some neurologists that work with us, and the wonderful thing is we are also a partner and an affiliate of Mass General Hospital. So if there is very complicated care, or we want and need access to some very advanced research for our patients, they're an excellent partner for us as well, that we're able to have those resources for our community.
Yeah, it's staggering to think of how complicated a life becomes when you realize your loved one has dementia, and the needs are astronomical and on an individual basis. I know some folks that have to take care of their spouse, and it's a 24/7, just 24/7, and so that's on the side. But if somebody is aspiring to work for Southern, or you have programs again, you other than just the nursing?
Yeah, so there are MA apprenticeship programs that we've worked with the community college. There are nursing programs. There are LNA apprenticeship programs. We've done some work beyond the stethoscope, so that involves some of our high school students coming and seeing what there are for career opportunities. And they get to see every part of the building, all the way from the boilers, to the operating room. So there are some of them that were fascinated by roles that they didn't even know existed. So we had some folks that decided they wanted to explore respiratory therapy. They get to see what's going on in the lab downstairs. We have medical technologists down there that are working, and we're sponsoring some students in those areas. We partner with University of New England for some of their medical students. So we're really engaged in trying to make sure that next generation is
We want them to stay here and live here. Exactly.
And we love to give them a good experience when they come work with us, so they want to come back and work with us there. And I think, I reflect on my own journey. I've been here for 30 years. I came here originally as a primary care provider and grew in the system. So there's a lot of opportunities to grow in healthcare, and I'm particularly proud of our system that we really try to see people's talents, make sure that we engage with those talents and develop those talents and help them grow so that we can serve our community.
So if somebody wants to get engaged in seeking a career there, who would they contact? How would they get in touch with you?
So
Do they get in touch with you? Or?
They're welcome to always get in touch with me. I'm happy to send them anywhere they would like to go. So we do have a director of workforce development. Her name is Victoria Druminskaya. She is definitely a resource and an access point. Any of our senior leaders are always happy to chat with folks about potential career opportunities. Any of our chief medical officers, Dr. Salvella, our Chief Medical Officer for the hospital, Dr. Joe Leahy, our Chief Nursing Officer, Sue Santana. Any of us would be more than happy to connect with folks and place them to the right persons. Our websites have all that information if people want to go on Southern New Hampshire Health. You can find us in any of those spaces and places.
So there's a bright opportunity if you want to get engaged with that, yeah. So I really appreciate you coming on the show. We have about a minute and 49 seconds. Are there anything else that you'd like the public to know about the Southern?
I'm excited about our dedication to the community. It's hard to be a not-for-profit hospital. We're here to serve the community, and we want to make sure what we do every day is we're there for that community. Some things are sort of fancy-fangled, and some things are the general things that we do every day just to make sure we're there in support. The preventive care, being there for those emergencies, and making sure that our patient's journey is smooth to wherever they're going. It's been a wonderful place to work, and it's a wonderful place to work because I think many of us feel very positive about taking care of the people here in Nashua.
Well, we appreciate you being here. It's nice to know that there is a resource that is immediately 7 minutes away. And with that, I want to thank the public for watching this show. And if you have an interest in being in the medical field or as a career, obviously check out Southern New Hampshire. And I appreciate you watching the show. And if you like the show, hit like. If you don't like the show, hit like and subscribe. But with that, we appreciate you watching. And if you want to come on the show, be happy to have you. Again, it's Speaking with the Senator. And until next week, thanks for watching.